Did you know that more than 1/3 of adults are affected by fatty liver disease? So there is a high chance that you and I are affected too. But don't worry, because today we have some new updates based on the latest published articles that can be game changers for people struggling with this disease. Hi everybody, welcome back to Dr. Solar channel. I am Dr. Fatima, and as of today, we're not gonna let fatty liver disease to go any step further in our bodies. Stay with me until the end of this video and let's go! Non-alcoholic fatty liver disease is a common condition where too much fat accumulates in the liver. This disease can also be linked to being overweight or having diabetes. Non-alcoholic fatty liver disease can sometimes worsen, leading to more serious liver damage like scarring, fibrosis, and in severe cases, it can progress to liver cancer or liver failure. But in today's video, we are going to go step by step and see what you would do in order to save our livers and make it clear again. Firstly, let's talk about diet. We all know that diet is very important for our health, but did you know that it's now a key player in treating non-alcoholic fatty liver disease? Recent studies have shown that not just one, but several diets can help manage this disease. The first diet is Mediterranean diet. It's not just about the ingredients, it's about the lifestyle that emphasizes the whole foods and heart-healthy fats. This diet is especially beneficial for people who have higher risk of cardiovascular diseases. It is rich in fruits, vegetables, whole grains, legumes, nuts, and olive oil. The next approved diet is ketogenic diet, which has gained a lot of attention recently. This diet is characterized by very low carbohydrate intake, moderate protein, and high fat. This diet shifts body's metabolism to burn fats for energy, a state known as ketosis. This diet can be particularly effective for people who are struggling with obesity and type 2 diabetes. By reducing carbohydrate intake drastically, it aids in significant liver fat reduction and can be a powerful tool to rapid weight loss. However, it requires careful planning and guidance, especially in people who have existing health issues. High-protein diets can be another fascinating option. These diets increase the intake of protein while maintaining the balance of other nutrients. These diets can be particularly effective for the people who have difficulty feeling full or satisfied with the traditional diets. High protein content can enhance satiety, reduce overall calorie intake, and improve metabolic function, all of which are beneficial in managing non-alcoholic fatty liver disease. This diet can be also effective for people who are more active or looking for a diet for building muscle mass. And lastly, let's talk about anti-inflammatory and whole grain diets. These diets focus on the foods that naturally combat inflammation, which is a critical factor in non-alcoholic fatty liver disease. They include a high intake of fruits, vegetables, nuts, seeds, and whole grains. These diets can be very beneficial for people who have elevated liver enzymes. They are also very beneficial for people who are experiencing chronic inflammation due to autoimmune diseases or metabolic syndrome. Whole grains in particular improve gut health and insulin sensitivity, making these diets highly beneficial for those with non-alcoholic fatty liver disease, especially when combined with other lifestyle changes. So, as you can see, you have a lot of options for picking a diet, but make sure that you consult with your doctor or dietitian who can provide you with a personalized guidance, picking the best diet for your specific situation. Alright, now let's talk about physical activity. Staying active is crucial, not just for overall health, but specifically for combating non-alcoholic fatty liver disease. Moderate aerobic exercise such as a brisk walk, cycling, or even swimming plays a significant role in reducing fat from your liver. This isn't about high-intensity workouts or becoming a gym enthusiast. It's about integrating simple, enjoyable activities into your daily routine. A brisk 30-minute walk in the park, a gentle bike ride, or a few laps in the community pool can have substantial benefits for your liver health. Studies have shown that regular physical activity can lead to a significant decrease in liver fat even without weight loss. So you don't have to lose weight, you just have to keep going every day. The key is consistency and finding an activity that you enjoy. It could be a morning walk with a friend, a dance class, or gardening, anything that keeps you moving. Now, for those who might have joint problems or mobility concerns, low-impact exercises like swimming or using an elliptical machine can be great alternatives. On the other hand, regular physical activity is not just about the physical aspect. It can also have a lot of great benefits for your mental health. Alright, now let's talk about the supplements and the food products that have shown great benefits for treating fatty liver disease. The first one is omega-3 fatty acids. These essential fats can be found in fish like salmon, mackerel, and sardines, and can act as champions against fat and inflammation in your liver. The American Heart Association suggests eating 2 servings of fatty fish per week to get the cardiovascular benefits, which also extend to liver health. But for those who don't consume fish, fish oil supplements can be a great alternative. The next one is vitamin E. Vitamin E is an antioxidant warrior. Oxidative stress can exacerbate non-alcoholic fatty liver disease, and vitamin E is known to defend you from oxidative stress. You can find vitamin E in nuts, seeds, and green leafy vegetables. For those with non-alcoholic fatty liver disease, especially with non-diabetic status, supplements may be recommended at a dose of around 400 to 800 per day. But when it comes to supplements, always make sure that you do it under medical supervision. The next one is garlic. Garlic supplements has shown to reduce weight and fat in people with non-alcoholic fatty liver disease. Probiotics and probiotics are also suggested by several studies. The gut-liver axis is a two-way street, and maintaining a healthy gut flora using pre- and probiotics can also improve your liver health. Fermented foods like yogurt, kefir, and sauerkraut, as well as fiber-rich foods like bananas and onions, are great for this. The next one is cranberry, which is rich in antioxidants. You should go for whole cranberries or pure cranberry juice without added sugar rather than supplements to avoid extra additives. The next one is curcumin, which is found in turmeric. These compounds have great anti-inflammatory properties for liver and can be consumed as a spice when cooking or as a supplement. And the last thing that you can consume is coffee. Yes, your morning coffee can do more than just waking you up. But when I'm saying coffee, I mean dark coffee without any sugar or milk. Coffee has a high level of antioxidant and anti-inflammatory compounds. And studies suggest that coffee consumption is associated with a lower risk of liver disease. Now, there are also some new medications that are suggested for treating non-alcoholic fatty liver disease, especially among patients who are struggling with obesity or diabetes. But we're not going to talk about all these medications in this video because then it's going to be too long, and also these medications need to be prescribed by your personal doctor. But if you guys really want to know about these medications and how they work, just leave me a comment and I can make another video about it. Thank you guys for watching until the end of this video, and I really hope that these points can help you get rid of fatty liver disease. Please don't forget to like and subscribe, and until the next video, bye!